All right. Well, everybody, thank you so much for joining us. I am beyond excited that we have the, in my opinion, foremost expert on hormonal health and healthy longevity for women in the world, Dr. Victoria Sorlie-Aguilar. Not only is she someone I respect, admire, and truly love, she's a member of WOW, which is a wonderful organization, and she's a practicing physician here in Southern California for over 20 years, revered by her patients. And I'll let her tell her story just a little bit very briefly, but I love the fact that she is a practicing physician and that this work she does in advocacy for women's hormonal health is literally her, what you might her passion, is spawned off of an already busy woman just dedicated to helping all of us as we continue to grow. So with that, thank you for coming. And Victoria, why don't you introduce yourself a bit?
Thank you so much, Jennifer. Thank you for inviting me, and thank you for the ladies that are showing up right now to listen. I am so excited to talk about longevity in women in midlife and beyond. And so much of what I do on a daily basis is in clinical medicine that I've practiced for 20 years is dealing with the consequences of people not being mindful about the decisions they make in their health and sort of dealing with things after the fact. And we do have a chance, if we have the right knowledge, to make some decisions along the way that can hugely change the trajectory of our lives, the quality of our lives, the length of our lives, the vibrancy and radiance of our lives. And I'm so excited to share that information. I'm so passionate about menopause because I went through it myself early, unexpectedly, and wasn't prepared at the time for myself, which drove me to deep dive into it several years ago so that I could become prepared, and realizing that if it was difficult for a physician to understand the consequences and treatment choices, how much more difficult it would be for women that didn't have a medical training in med school and residency and clinical practice. So I'm so excited to put all of that together and consolidate that in practical steps that we can take to make our life longer, stronger, and more joyful. So thank you for having this idea to put this together and giving me the opportunity to talk about it a little bit.
Well, I think it's important, and I'll tell you why. They don't teach us anything. I mean, until about half a year ago, I think this was like one of the most taboo topics in the Gestalt. And I'm shocked because it literally impacts 50% of the human population. So I like to do things once I discover a problem. So thank you for taking charge. And it doesn't surprise me that you didn't have any support or information, because as far as I know, literally until this year, it was something people didn't even want to talk about. Instead, now we have the freedom of talking about it openly, even on LinkedIn. We can promote a webinar. So here's to progress. And with that, why don't we just kind of pop right in. Look, before we get into this, I want to explain part of the reason I consider Dr. Victoria Sorlie-Aguilar such an important constituent is, as you know, I'm in risk management, and I very much know the correlation between sickness and disease and what happens later in life to human beings, because we look at everything from, you know, providing for long-term care standpoint. And it's really kind of dire and awful. And then here I've met this wonderful sister who specializes in taking care of humans as they're approaching that period of their lives. And we're learning about all the things we can do that improve our ability to age in a comfortable way. So the combination of that, plus the things we can do with our finances, is sort of just an ultimate Oreo cookie, in my opinion. So with that, let's just talk about some statistics, Victoria, and we can dive right in.
Yeah, thank you. So one of the things I just want to make that distinction for us between our health span and our lifespan, right? Our lifespan is the amount of time we are alive on Earth from birth to death. And our health span is the amount of time we are alive on Earth without serious diseases. And I think some of us focus on lifespan without health span. And that's why I want to talk about what are the things that get in the way of us living a long and healthy life. So that's where we can focus our attention. Women, on average, we do live 4 to 5 years longer than men. On average, women live to be about 80 years old. But if you look at the people who survive, like call them centenarians, to be like 100, 85% of those are women. So we are set up genetically to live a little bit longer than men and to have good long lives, at least 8 decades. And we can make proactive decisions, like I said, to change the trajectory of how we age, how our cells break down, what toxins we're exposed to, and how we protect our brains and hearts and bodies in ways that slow down the aging process and effectively avoid preventable diseases. I think one of the things that I'm not sure how many people know, but I don't hear it talked about too much. I'm not sure how many people are aware that the actual number one reason that women die is heart disease. 1 in 3 women will die from heart disease. And that's huge. That's huge. And that the reason why that's important is because this is not something that we are destined to have. It's something that's a result of risk factors of our life that we have total control over. Many of them, we have total control over them. And a lot of women worry about breast cancer, just to pair those two together. And our lifetime risk of breast cancer is 1 in 8 of getting it, 1 in 30 of dying from it for women. But our lifetime risk of dying from heart disease is 1 in 3. So the way the odds are, we would probably do better to focus on the diseases that are most likely to get to take our lives and that are modifiable. So if we know that 90% of heart disease is caused by risk factors that we can change, then all we need to do is figure out what those risk factors are and figure out what we need to do to change them. So a lot of people know about high blood pressure and high cholesterol, totally modifiable, we're not doomed to have those things. There's a couple people who are born with like a genetic high blood pressure or a genetic high cholesterol, but that is not the majority of people. The majority of people, those are lifestyle outcomes. Also smoking and being obese and having diabetes, being sedentary, and how much alcohol we drink, how much stress we have, and depression, all of those are risk factors for heart disease. And one reason why that's really important for midlife and menopause and women is because when women are after the age of 50, meaning after the average age of menopause, suddenly we have a shift in our body's biochemistry, which puts us at an instantaneous increased risk of heart disease. And what happens is before menopause, we have estrogen, which protects our hearts, protects our blood vessels, lowers our cholesterol, helps us maintain metabolism and fat distribution. But after we lose it in menopause, whether or not we gain a pound, when we go into menopause, there's this shift towards fat, towards the middle. They call that visceral fat. And that's not our fault. It's nothing that we did. We didn't get lazy. We didn't stop exercising. Even if we ate exactly the same, we still get this shift towards fat, towards the middle, which ultimately leads to inflammation and insulin resistance and cholesterol and heart disease. And this is something that happens with menopause. And I think a lot of women aren't aware of that. And they aren't aware of the fact that estrogen actually lowers our bad cholesterol. And without it, like what happens in natural menopause transition, our bad cholesterol that we maintained in healthy levels our whole pre-menopause life, suddenly we're like, hey, wait, why did my cholesterol go up when you went to see your doctor for your annual physical? It was the menopause. Without you doing a different thing at all, your blood pressure likely went up, your bad cholesterol likely went up, and your body fat and risk for diabetes likely went up, all because of menopause.
So let me just let me see if I'm understanding what you're saying correctly, because this is kind of blowing my mind.
I know.
You're saying that we've been taught all our lives how scary and dangerous hormones are, and that they all cause cancer and that we'll die if we take them. But in fact, the not taking replacement hormones could theoretically put us at greater risk of heart disease, dying, and visceral body fat in order of priority, I guess, because I mean, obviously how we look is less of a priority over how we feel and how we are actually healthy. But all of those things are byproducts of the drop in hormones. And so, I mean, when you and I first started talking, I think the point you made to me that blew my mind, and it was the point you discovered on your own when you went down this rabbit hole, is that what we've been taught by conventional medicine for the last 30 years is very backwards in how they've looked at the risks. And they've come at a cover their own tushes kind of thing. Like, oh, there was one study where somebody got breast cancer, and so they were like, hormones are horrible. When you take a more cogent look at all the risk, you find that not taking hormones can put you at greater risk than taking hormones if the hormones are used sagaciously, like sagely.
Yes. And what's really interesting is a lot of the data that's quoted as the reason why women have been led toward or away from hormones are based on studies that were done over 20 years ago with hormones that aren't used in common practice today because science evolves, medicine evolves, we get better. But because, I don't know, the priority of where women's health is in medicine and funding, the Women's Health Initiative, which was a study that ended in 2002, over 20 years ago now, the hugest United States study on women's health was like $1 billion study, the largest of its time, and nothing has been done that huge since then. Most of the things we talk about in terms of recommendations today in 2023 are based on old data from 2002 and before that, because the study went on for several years. So we are making decisions in 2023 based off information that was gathered 2 decades ago with medicines that aren't common in use today. And the science and the recommendations and the guidelines have not kept up with reality. The old guidelines have not kept up with current day reality. So when I say that the estrogen that's prescribed in hormone therapy today is estradiol, it's a body identical hormone, which people get kind of confused with what is bioidentical, what is body identical. But basically, technology has advanced so that when we prescribe hormones in 2023, we prescribe a chemical that is molecularly identical to the estradiol, estrogen produced from the ovaries before menopause. Molecularly identical, plant-based from yams, identical. And the same thing for the progesterone that we now prescribe in 2023, which is the other female hormone, identical to what's produced in the body before menopause. But 2 decades ago, when they did these studies that scared off a lot of women from hormone therapy, they used synthetic products that were not identical to what's produced in the body and were, in fact, the estrogen was derived from horse urine, Premarin. And it's not to judge what they did back then, it's what they had. They used the best thing they had back then. But science has evolved, technology has evolved, but the recommendations or the general understanding did not evolve. For some women and men and doctors and advocates who are deep into this field, they understand the nuance. They get that the meds change, they get that the guidelines change. But for the general population at large, the tides are starting to turn, but most women are still sort of have some vague misunderstanding. Like, I think hormones cause cancer. I think I'll have a heart attack and dementia if I take them. And the actual facts are much more nuanced than that. Even if you look at just the old meds they used 2 decades ago, I mean, even just going off the old stats from 2 decades ago, using those older outdated meds, even then, it's now understood that women who go into menopause and choose to use hormone therapy within 10 years of their menopause, so if you went into menopause at 50, by age 60, or if you were like me and went into menopause before age 45, before 10 years passed, your risks of having menopause hormone therapy were less than the benefits that you would derive from that same hormone therapy. And I've said it now dozens and dozens of times on dozens of podcasts, but I still think the majority of women do not absorb that concept. And it doesn't mean that the guidelines don't recommend that women use hormone therapy for prevention in general. They're not saying like an aspirin, like an apple a day, like every woman should be on hormones so she can live a long life. That is not the guidelines. But the guidelines are clear that if a woman is having hormone menopause symptoms, hot flashes, night sweats, vaginal dryness, brain fog, all of that, and she decides to use menopause hormone therapy in careful consideration with her doctor, discussing her risk factors, if she makes that choice, informed choice, she can feel confident knowing that the risks of that choice are much lower than the myriad benefits that she will get from having made that choice. Because not only will the hormone therapy treat her symptoms, which she knows she's having, she knows she's having hot flashes, she knows she's not sleeping, she knows she's having brain fog and maybe some depression and anxiety and vaginal dryness and skin dryness and all of that, but she will derive benefits that she wasn't even aware that she was going to get. It's like you get the treatment of your symptoms, but plus all these other benefits that I think women don't know about. I think women don't know that when they use menopause hormone therapy, they are decreasing their risk of colon cancer, which is a huge killer of people in the United States. They are decreasing their risk of osteoporotic hip fractures, which is huge. It's a major cause for disability in the United States. And they are decreasing their risk of diabetes, which is a huge risk factor for heart disease. These are fringe benefits of a hormone therapy that treats menopause symptoms, and for women within 10 years of menopause for whom the risks are far outweighed by the benefits that they are aware of because they can feel that relief from their symptoms, and the many benefits that they'll never even know that they're getting.
This is nuts. Because I am one of those people who literally, I'm all earthy, organic. I like clean food, etc. So I was like, hormones are crazy. They give you cancer. Never. Like, no way. And and that was literally what I thought till 6 months ago. And I still thought the hormones were made from horse urine. So what blows my mind is that we don't use a cell phone that's even 2 years old, but we're still using medical advice that's over 20 years old. And it's not dissimilar to my practice in insurance, where products have crazy evolved in the last 30 years, especially long-term care products. And yet online, we still get all the conventional wisdom from like Motley Fool or whoever else is the often patriarchal guru about expertise when it comes to things. And they'll just make blanket statements about things when it's really just not even the same landscape that they're giving opinions on. And they're also not deep diving on it at all. Like Motley Fool, I love that he opines about insurance, and yet he's like a stock picker. So it's kind of wild to me. And I think, male doctors, I don't know that many yet that are passionate about hormonal health. I think you know a few, but women are very incentivized to figure this out because it's pretty real what goes on, and you've told me some
It's
of the
life and death. It's life and death and disability if we choose uninformed. And like you said, Motley Fool, people get their information from Googling and scrolling. And if you Google and scroll, if you try to Google and scroll this meaning your life, your health decisions, you will get so many conflicting, confusing answers that it boggles the mind. I read through these things every day because it's like kind of my passion / obsession, because I want to make sure. I'm like kind of OCD about medicine. I care. I want to be right. I want to be at the forefront. I don't want to be talking about stuff that isn't correct. I don't want someone to say, hey, that's not right. That's changed. I want to be the one who's at the forefront. And because I'm always searching and looking and reading at everything that comes up, I see so many things that I say, this isn't right. This is completely wrong. And then I sort of deep dive into where it came from. And I realize it's some crap supplement or somebody with an agenda or somebody who's not up to date, and misinforming the public. And I think if it's a jungle for me to parse that out, it's got to be a jungle for everyone else. And people have a lot of ulterior motives for what they promote. For example, I do agree. I mean, I like natural things too. I eat organic food, and I try to avoid antibiotics for myself, and I try to live sort of clean as well. And I didn't even understand until I deep dove the difference between the old hormones and the new hormones. The fact that the new hormones are made from plants, derived from plants. And the fact that the old hormones came from animal urine, that is something that was lost on even me up till I tried to figure it out for myself. And I asked a couple of colleagues, like, what do you think, Premarin versus estradiol? They're like, it's the same. It's just the same. It is not the same. It is not the same. It is different, because one thing is identical to your body and one thing is synthetic and identical to a horse's body, which horses are great, but we are not horses. And it's fine that penicillin was the best antibiotic we had 100 years ago. And it's fine that pregnant mare urine was the best thing we had, but science has evolved. We don't treat everything with penicillin anymore, So we shouldn't treat women's hormone with horse urine the same as they did, 50 years ago. And because they've found ways of synthesizing plants into hormones that are body identical, the way that our body uses them, the efficiency with which we use them, the directness with which we use them, the fact that they figured out how to make estradiol um, skin absorbed is huge. The fact that we don't have to take a pill to get estrogen means that we can bypass the metabolism through our stomach and our intestines and our liver, which is really important. And it can be directly absorbed into our bloodstream, makes today's estradiol much safer than the Premarin that was prescribed 50 years ago, because it hasn't been shown to increase the risk of clot and lung clot the way that the Premarin from 50 years ago did increase it, because it was metabolized through the liver, and our liver is what's responsible for increasing our risk of clot. So if we bypass that with newer technology, which it's not that new, but it's been around now and tried and true, then we have a cleaner estradiol, a cleaner body identical estrogen with less risk to us of blood clots and lung clots, with a cleaner sort of direct mechanism of action to our blood, and we get the benefits without the risk that we have from the old Premarins. They are not the same. Many doctors still think they are, especially the ones that aren't involved deeply in menopause. But women should know that way when they talk to their doctor, they know to ask, are you giving me body identical estradiol? And you don't have to go to a compounded pharmacy or get a pellet or get some sort of fancy, sexy, cash only estradiol. Estradiol, body identical, is FDA approved, read covered by insurance, and you can get it at Vaughn's or CVS or whatever, because it's not anything like extra special fancy. It's bioidentical, it's FDA approved, it's generic, it's super cheap.
Oh my
Yeah.
gosh. You know, we only have 5 minutes left, which is
Oh my
really sad.
gosh.
I think we're going to need to try and do more of these because we've already had a couple questions in the chat. And I know you and I had like 3 more pages of stuff to get through. So I think here's what I'd like to ask a couple questions, okay? Number
Yeah.
one, how do we, when we know that there's so much like nuance that only few people have really taken the time to care about, how do we find a good source for that information from you? Like, I know that going on the internet isn't going to be great, and I don't want to do that. I'd like to like be able to say, Dr. Victoria, please tell me everything that you know. How do I spend more time with you if I want to for my own personal questions?
Of course, a woman wants to talk to her own doctor as a first stop because your doctor knows you best. And if you're not able to get the care that you need to keep asking. You could be referred to an endocrinologist. You could try your OBGYN. If you want to talk to a doctor one-on-one and talk about your specific history and talk more in detail about what hormone therapies are available, which are the safest, which are effective, what they're used for, you could go to feminineflamemd.com. You could book a one-on-one session with me by Zoom. We could talk about this for 50 minutes to an hour and deep dive, because we are not average women. We are nuanced. We have histories. We have family histories. We have personal mental health histories. We have so much nuance about us, and most times in a quick 20-minute doctor visit, you're not going to get it done. And Googling on the internet, you're not going to get it done. And oftentimes you need nuanced attention and guidance.